We got to get to something today. So people have been, again, my dick riding haters have been, that should be a t-shirt, my dick riding haters, have been trying to, remember they tried to make me out to be being paid by Assad. They tried to make me out to be a Trumper because I debunked Russiagate. They try, so now they're trying to make me out to be an anti-vaxxer because I have a critique of the establishment's COVID narrative. And which from the left, by the way, I'm anti-mandate. Now now this is how I approached it last year, because they were telling us that if we got vaccinated, we could get rid of this pandemic, like you got rid of polio and smallpox. If everybody got vaccinated, it would get rid of it. That's what they were saying, right, last year.
We make sure that the vaccines are affordable, and we think it's important to make that point because of what...
She wants to make the vaccines affordable.
She is a virus.
Yes. What kind of... You have to have a virus in your brain to think that, hey, we could have... Well, here's what I said. Of course, we could distribute the vaccine to all citizens as soon as it's available and stop a pandemic, but we're not filthy socialists, so lots of people are going to die. That's what she's saying. A functioning government would fucking inoculate its citizenry against a goddamn pandemic and forget about a fucking profit motive. But that's how fucking infected their brains are by capitalism and corporatism that they can't even stop a pandemic without a little profit, baby. They'll have a little profit.
So that's when we were told the vaccines would get rid of the virus, and if everybody got vaccinated, we could get rid of it. And of course, I was all for it. This was last year, 2020, right? Must have been early 2020, like February 2020, right? Because we got locked down March 2nd. Anyway, so then, of course, I got double vaxxed, and I got injured by the vax. That's not what this story's about. But it made me start looking harder into the COVID policy. That's coming from, and I found out Fauci's a pathological liar. We've documented that, and not to be trusted at all. And then I brought on Robert Malone, Dr. Robert Malone, because he had a counter narrative to the establishment, to the big pharma funded narrative, and Fauci, who we had caught lying blatantly several times, 3 times, about big things. And so he is credited with being one of the inventors of the mRNA vaccine technology. No one denies that he was the first one to do the thing that you have to do to start mRNA vaccine technology. No one denies he did that. And then lots of other scientists have built on that technology, and there you go. And so this guy, they've also tried to make him out to be anti-vax. He's not. He has worked on vaccines his entire life. He's worked at the Salk Institute, and now he's working on another vaccine as we speak. So anyway, here's what he said, which changed my mind about, not just changed my mind, but after we realized that I'll just play it for you. Something I heard you say before, that we can't vaccinate our way out of this pandemic, and we shouldn't be trying to do that.
In a outbreak, when there is very active spread of high levels of virus, you cannot vaccinate your way out of the risk of that virus during an active outbreak with an imperfect, leaky vaccine. And that's what we have.
So what he just said, what was news to me before I had heard him say it, was that you can't vaccinate your way out of this pandemic. An outbreak in a pandemic like this with a leaky vaccine. Leaky meaning that even if you're vaccinated, you can still get the virus and you can still transmit it. And it's really leaky. Okay, so people try to make me out to be anti-vaxxer. Again, my bad faith attackers, when I'm constantly telling people to get vaxxed, and which is what he recommended too. Robert Malone, Dr. recommended that if you're vulnerable, you're elderly, you have comorbidity, you should get vaccinated. His theory is that it's going to become anyway. We'll get to that. But here's what I'm taking the vaccine reduces your symptoms and your likelihood of serious infection or serious disease, having to go to the hospital or end up in an ICU. So we've always said that. So if you're afraid of the virus and you want to reduce your chances of getting seriously ill, you should get vaccinated. So that's what we've always said on this show. I'll show you another video of me saying it. Yes, it's important that the elderly and people with underlying health conditions get vaccinated. I agree with that. There's another one. Here's another one. Here's another video of me saying with Nick Cruz from the Fred Hampton Leftists. And they have the lowest transmission rate in the country right now in Florida. Now, they do have a higher rate of people who, once they get infected, get serious illness. They have a higher rate of that. Well, that's because those people aren't vaccinated. So again, if you are afraid for yourself and if you're in a vulnerable population, you should get vaccinated. And then you won't get that. You won't go to the hospital. Less likely you will. So why are you stop worrying about unvaccinated people? Make sure you're vaccinated. If you're vulnerable, make sure you're vaccinated. So I don't know how much more emphasis I could put on it. But there it is. That's the message of this show. Then people want to make it out that I'm opposite that I'm anti-vax. No, because I have a critique of the COVID response from the government and the establishment media. That doesn't make me, but that's what people want to make this out to be. So, in fact, here I am. Even when I tweet stuff out like this, people always come back and call me anti-vaxxer. So I go, when Jen Psaki got COVID, the press secretary for Biden, I tweeted out Psaki's infection is consistent with what Biden's director of COVID response asserted. Everyone is going to get COVID at some point, no matter how many people get vaccinated. It's not going away. Of course, vaccination protects you from serious illness and hospitalization, no one else. Does that sound like an anti-vaxxer guy? Of course, vaccination protects you from serious illness and hospitalization. Does that sound like an anti-vax guy? And then here's Andy Slavitt, who we're going to get to later. He was Biden's COVID response director. And here he says, it's going to be so contagious that everyone will get the virus. So we're going to get back to that. And here's another one. I tweeted out, people inoculated against COVID-19 are just as likely to spread the Delta variant of the virus to contacts in their household as those who haven't had shots, according to new research. If you are vulnerable, you should definitely get vaxxed to protect yourself. So that's the message of this show. So people try to make it off like, oh, Jimmy's doing something nefarious. He's being anti-vax to get an anti-vax crowd. No, we're anti-mandate here, and we're anti-mandate from a scientific standpoint and, as Professor Richard Wolff pointed out, from a lefty worker critique standpoint. And then people try to flip that into your anti-vax, and that's not the case. And another thing is, vaccinated or not, everyone is likely to get COVID-19 at some point, many experts say. So again, this is reinforcing the point of this show that mandates are ridiculous, because if you are vaccinated, you can still shed the virus. You still are just as likely to transmit it, and everyone knows you're going to get it. No matter if you're vaccinated or not, everyone will eventually get an infection of COVID. So why does it matter to you if you get that infection from a vaccinated person or an unvaccinated person? If you're going to get it and you want to reduce your chances of hospitalization or death, you should get vaccinated because you're going to get it. That's always been the message of this show. So, but here, just to drive it home, once upon a time, hopes are that most people would escape COVID-19 infection, but the Delta variant, about as contagious as chickenpox, has changed all that. Dr. Bruce Patterson, a virologist and CEO of Vincell DX, counts himself among the 90% of infectious disease and virology experts who believe COVID will become endemic, meaning it will hang around indefinitely like the flu. COVID is here to stay. We're not going to eradicate COVID. 10 years from now, there's still going to be COVID. So that's the point. So that's why mandates make no sense. That's from a scientific point of view. Because vaccines are there to protect yourself. It doesn't protect you from spreading it. It doesn't protect you from getting it. And in fact, everyone's going to get it. So that has been our position. And if you feel you're vulnerable, you should get. Bill Maher doesn't want to get vaccinated. People who have natural immunity don't want to get vaccinated. I got vaccinated. I got injured by the jab. So, by the way, you know who else says this? The WHO says it won't be eradicated. They were saying that back in September, which is when right around when we started saying it, when Dr. Malone came on our show. And here's Andy Slavitt. We clipped this from, he had a whole thread about COVID, and we clipped this because this is the important part I want to share with you. The important part I want to share with you is that given Delta's contagiousness and the fitness of future mutations in order to beat it, this means SARS-CoV-2 will be contagious enough that everyone will get the virus. That's Biden's former director for COVID response. So if everyone so that's the point of this show, and no one else is really reporting this the way we're reporting it. Right? And because people are wanting us to hate our neighbor. People are wanting us to hate our neighbor and turn on a bus driver or a nurse or a teacher. And I'm not going to do that. It's not their fault. No matter who gets vaccinated, you're not going to stop COVID. You can stop infection in yourself from being serious or hospitalization by getting vaccinated. That's where it ends. But everybody wants you to hate the unvaccinated because that's the captured media's response and the captured government's response from Big Pharma. They even want to jab kids, and I'm going to show you why that's crazy. But here they are demonizing the unvaccinated, even though everyone's going to get it, and the only way to protect yourself is for you to get vaccinated.
The data is very clear. As Dr. Walensky said on an earlier briefing today, this is really becoming a pandemic of the unvaccinated.
Well, ironically, she got it. So she's vaccinated and she got it. And now studies, that's why we covered this on this show. So now lots of countries who have high rates of vaccination still have high rates of transmission. And the reason why I bring you this story, again, is to show you that you can't vaccinate your way out of this pandemic, that coronavirus will be with us circulating forever. That's what's called an endemic. So I'm trying to lessen the vitriol and the division in this country between people who are unvaccinated and vax. I'm trying to convince them that an unvaccinated person has nothing to do with you or your health. And so, but they want us to turn on each other. I want to keep everybody's eye on the ball. The establishment could have saved over 200,000 lives in this pandemic had they given us universal health care, which they still deny us. I want people to keep their eye on the ball. That's who we should be angry at, and that's who we should have our ire for, not for our fellow worker or our neighbor, and I refuse to do that. If you think your enemy is an unvaxxed teacher, school bus driver, or a nurse's aide, you've been propagandized. They are not your enemy. Your enemy is the oligarchy that is denying you health care in a pandemic and locking you down without giving you a paycheck like the rest of the Western world. That's the enemy. The enemy isn't your neighbor. But that's what the shit libs, and that's what the establishment, and that's what the government wants you to do. They want you to turn on each other, and our messages don't do that. And one of the reasons is why, because some of the highest vaccinated countries are having the biggest outbreaks they've ever had, proving our point. For instance, when we covered this is from September. This is an article from Fortune from September 28th. It says, highly vaccinated, but more cases than ever, Singapore shows the world what endemic COVID might look like. And what might it look like? Well, on Monday, Singapore recorded 1,647 cases of COVID-19, bringing its 7-day daily average to 1,545 cases, higher than any other previous wave of the pandemic. Experts say that Singapore's climbing cases, more than half of which are in vaccinated individuals, may signal that COVID-19 is becoming an endemic disease in the city-state, meaning COVID-19 circulates in a population like its 4 coronavirus cousins, but doesn't upend lives due to a widespread immunity. So it's become an endemic. Singapore has now fully vaccinated over 80% of its population, one of the highest rates in the world. China's fully vaccinated rate is 73%, while European Union and U.S. have fully vaccinated 65% and 55% of their populations, respectively. In May, Singapore Prime Minister introduced the government's plan to live with the virus and transition away from COVID-0 approach. That approach was lockdowns and masks and distancing and all that stuff. And so now they've decided to make it an endemic and live with the virus because they're super vaccinated and they're still having big outbreaks. But you get vaccinated, and that reduces the death rate and the hospitalization rate, as we've said on this show a zillion times. Singapore has used COVID-19 vaccines from U.S. Pfizer and Moderna for its national campaign, while some private clinics have also distributed doses from China's Sinovac for individuals that prefer the Chinese jab. But Singapore's growing caseload has raised alarms nonetheless because of the speed at which cases have climbed. Now, when we originally reported this graphic here is incorrect. This graphic here was put together by my producer, and he joined together two sentences that didn't go together, and he added a word, despite. So if you're going to add a word, you have to put brackets around it so people know you've added a word and it wasn't in the source text. He didn't do that. And then he changed the tense of these two words to make it fit syntactically or grammatically with the rest of the sentence. Now, you could combine two sentences, but you have to put a ... and then so people know that you're jumping ahead. And so, but that didn't do that. Plus, that was supposed to be a period, and he put a comma. And then he put this, and it actually changed the meaning of this sentence. It didn't mean what. So, by the way, doesn't change. So I have to cover that, right? Because that was fucked up. And I didn't know about that. I had to trust my producer that we went over the story. He put it together. I had no idea he was going to take two sentences, jam them together, and add a word without putting it in a bracket. So I had no idea when I did this segment originally that had happened. That was done by my producer who put it together. I asked him why he did it, and he didn't really have a good excuse. He said, I was in a hurry, I got sloppy, and I'm stupid. Unfortunately, he can't be with us anymore because I can't have someone on like that who's sloppy, stupid, and does something like that. And so, unfortunately, he's no longer with us. So someone's paid a price for this. But it didn't change the thrust of the reporting, which is stop blaming the unvaccinated for this, stop demonizing your neighbor, and to drive home the point that you can't vaccinate your way out of this pandemic. This doesn't change any of those facts. It does change one thing about this sentence, and that was wrong, and so that's why he's gone. But even after, so here's how he put it. Here's where it comes from, right? So, but Singapore's growing caseload has raised alarms nonetheless because of the speed at which cases have climbed. And there's a period. And he put a comma, and then he jumps down to here. The policy included, and then he then he said, despite policies including stay at home. That is not accurate. And then he didn't put the brackets, and then, so that was wrong. And that was effed up. And so, but even in that, so we correct it. So here I am correcting it, which is a huge difference between my critics who have never corrected their Russiagate bullshit, 100% conspiracy theory, fucking 5 years straight, still going. They've never corrected any. They've never corrected their Syriagate bullshit. People have said, I worked for Assad and I'm Russian and I worked for Trump. So again, the reason why we're correcting that is because it was brought to my attention and I figured out that actually happened, and I'm correcting it because we have integrity at the show. That's all we have is our word. So I caught that. It's corrected. It's been dealt with, and we're going to have to, I'm glad someone pointed that out to me because I wouldn't want that to go out. Unfortunately, it did. We're correcting it. There we go. Doesn't change the thrust of it, doesn't make me an anti-vaxxer, because even later in that same segment, here I am with that bad graphic that was put together by my ex-producer. There I am there. And listen to what I say. This isn't about whether the vax works or not. This is that even if you get 80% vaccinated, you're still going to have huge outbreaks of COVID. That's what it's about. So that was what the point of me showing some of that article was. That was the point, was that even if you get 80% vaccinated, you're still going to have huge outbreaks. So that's why we got to stop having mandates. And if you're going to get vaccinated, like the Harvard study showed, the reason why you get vaccinated is to protect yourself, which is what we've been saying at the show. And I just want to drive it home that being anti-mandate is not anti-vax, because here's Dr. Fauci from last year, August of 2020, telling you mandates are wrong. Listen.
And do you foresee that the vaccine might be mandated for any populations, perhaps for school-age children?
No, I don't think you'll ever see a mandating of vaccine, particularly for the general public. Sometimes in the health sector, like in my hospital here at NIH, you're not going to be allowed to go on the ward unless you get a flu vaccine. But you would never mandate, at least I do not think you would. I'd be pretty surprised if you mandated it for any element of the general public.
Now, as a primary care physician myself, who's had many conversations around vaccine safety with patients, I'm curious, what's our contingency plan for people who might refuse the vaccine?
Well, I mean, they have every right to refuse vaccine. I don't think you need a contingency plan. If someone refuses the vaccine in the general public, then there's nothing you can do about that. You cannot force someone to take a vaccine.
Right.
So that was him, and nobody can tell me what changed in 1 year. And here is Nancy Pelosi saying the same thing.
So here's the thing. We cannot require someone to be vaccinated. That's just not what we can do. It is a matter of privacy to know who is or who isn't.
So they all switched. I have a critique of that. And because I'm criticizing the Democratic Party, all the Democratic hack establishments call me anti-vax. They've been calling me names. They called me a conspiracy theorist when I was debunking Russiagate. They called me a conspiracy theorist when I was debunking the false flag gas attacks in Syria. Of course they're going to do that. Of course that's what they're going to do. So don't let them fool you, right? Don't let that happen. By the way, you know who else is against mandates? Fucking Black Lives Matter of New York is against it. Does that make him a Trumper? Does that make him, is that guy grifting? Is he anti-vax? Here's Richard Wolff. Anti-mandate movement is not all right-wing or anti-vax. Its labor militancy component deserves interest and support. It's an important opportunity to fight the right and build the left. And if you push those people who are militant in their workplace against the government and their employers mandating them a medical procedure, you're pushing them out of the left into the right wing's hands, and they will grab those people up. And that is why that's a stupid failure. Why else should people not be vaccinated? Well, here's Dr. Sanjay Gupta. 45 million people, I think, have already had COVID, if not more. Look up how many people have had COVID. And they have natural immunity, which is better than you get from a vaccine. And this question was asked of Dr. Fauci, and listen to what he said.
There was a study that came out of Israel about natural immunity, and basically the headline was that natural immunity provides a lot of protection, even better than the vaccines alone. What are people to make of that? So as we talk about vaccine mandates, I get calls all the time. People say, I've already had COVID, I'm protected, and now the study says maybe even more protected than the vaccine alone. Should they also get the vaccine? How do you make the case to them?
That's a really good point, Sanjay. I don't have a really firm answer for you on that.
So he doesn't have a real firm answer for him on that. Okay, so that guy's an idiot and a liar, and we shouldn't be listened to. And I'm proud to make a critique from the left of the COVID response from him, the government, and Big Pharma. And guess what? Here I am again telling you to get vaxxed if you think you're vulnerable. We're set. I'm with him. I want some bodily autonomy. And if you want a vaccine, you should get a vaccine because it'll protect you. So when have I never said that? I've always said that. If you should get a vaccine because it'll protect you from serious illness and hospitalization. So again, there is my dick riding haters trying to make out that somehow Jimmy Dore is some conniving anti-vaxxer, which that just isn't the case. I do have a strong critique of Fauci, the Biden administration. FDA heads have resigned because of Biden pushing the boosters against the science. The head of the vaccine department at the FDA resigned over it. So there's, by the way, now there's a Pfizer whistleblower saying the trials for the vaccines weren't done correctly. And now we know that. So we should always be critical from the left of the government and of big pharma and of the establishment media, which is what I'm doing here. And because I'm doing that, my dick riding haters try to smear me as a conspiracy theorist, a Trumper, and now as anti-vaxxer. So now you know the rest of the story. I want to let you know, on November 6th, we're going to be in Baltimore. November 11th, we're in Tempe, Arizona. November 12th, we're doing Los Angeles and Studio City. November 19th, Los Angeles and Studio City. And then Thanksgiving weekend in Portland, Oregon. Go to jimmydoorecomedy.com for a link for all those tickets.